nurses are being paid because they work. They replace staff nurses in accordance with the national agreement on a ratio of 2 to 1. Even if the government got away with it, it is false economy, because if the replacement factor goes, then the staff nurses that were replaced in accordance with the ratio will have to be re-employed. Pressure by the P&A saw the setting up of a high-level working group where employer and employee representatives, regulatory agencies and professional bodies came together to devise a strategy for work-related aggression and violence within the Irish Health Service. This strategy, linking service and safety, was officially launched by Professor Drum on the 9th of April 2009. And he stated that he was pleased to endorse this recommendation, and in this regard published a position paper setting out the need to focus very deliberately on successfully meeting the various targets and deliverables set out in the report. And his hope that the HSE future actions in implementing the actions in the report will not only serve our staff very well in terms of their health and safety, but will most likely place us to the fore internationally as an example of best practice. And again, I'd like Seamus Murphy to take a bow on this one and the amount of work he put into this over a long, long time. That last piece came to pass as an example. It has been endorsed by the World Health Organization. It has been presented and accepted at conferences all over the world as being the foremost authoritative policy document on violence and aggression at work. Unfortunately, none of its recommendations have been implemented at home, but what's new? We export everything that is good. Look at our new graduate nurses. A project joint governance committee was set up, comprising of management and unions, patient advocacy representatives, etc., to guide a central projects office in implementing the programme of strategic actions, which should not, according to the report, be delayed, and a number of which should be completed within the first year. Among these, ensure compliance with safety statements and risk assessments, establish safety of lone workers, establish safety of physical interventions, standardise guidance and the provision of education and training, develop a staff support system, and develop standards on the use of physical intervention. The Central Projects Office was not put in place, and despite ongoing pressure from the Joint Governance Committee, nothing happened. It culminated in the joint chairs of this committee, Mr Martin Rogan, the Assistant National Director, and Seamus Murphy from the P&A, requesting an opportunity to address Mr McGee, CEO, and the board of the HSE. This unique event happened on the 22nd of March this year, and Seamus Murphy tells me that he put it to Mr McGee, and we all know how Seamus can put it, and the HSE board, that it was totally unacceptable, that absolutely nothing has happened in respect of the implementation of this support for the last 2 years, and that several members were considering resigning from the project Joint Governance Committee. I am delighted to say that following this meeting, things are now happening. A project director is being identified as we speak, and it is our hope now that we will immediately see significant movement on implementing the actions set out in the report, which will, we hope, make the places where we work much safer for both staff and patients. The second meanest stroke ever pulled by the Department of Health occurred in 2009, when they decided that the senior staff nurse post was a promotional post and refused to sanction those qualifying in 2009 and again in 2010. Because, according to them, the moratorium specifically prevented the filling of all promotional posts. This matter was referred to the Labour Court last year, and the Labour Court found that it did not constitute a promotion and recommended that the parties will go back to talks. The Department of Health now state that this issue is with the Department of Finance. We would again point to the fact that the development of this grade is the result of an agreement to settle the biggest industrial dispute in the history of this state in 1999. And failure to honour the terms of this national settlement, and indeed the recent decision of the Labour Court, will have serious consequences in terms of trust and cooperation in the years ahead. In conclusion, Minister, you know and I know, and all of our members on the front line of care know, that there is one essential priority for our people, that when they are sick, when they are in need, that easily accessible and properly resourced services are available to them. This is the premise of which the health system must be operated. The key to this is the optimal use of the skills of our professionals in frontline care. Continuous cuts to mental health and ID services by salami slicing and cutting back on evidence-based services will result in increased costs to the system as a whole over future decades. Our nurses deliver huge value to the system. We can deliver even better value if and when all our skills are recognised, when we are freed up to maximise our potential, and when the patient is put at the centre of care and the blockers of innovation are marginalised. We believe you and your colleagues, Ministers Lynch and Shortall, can deliver a better service for our people. We are here to help you. And just to remember, and just to say a word of thanks to the outgoing Officer Board for their hard work on a voluntary basis during the past year. Again, our National Treasurer for special mention, Paul, has done a brilliant job with a very challenging brief. And the Finance Committee, also with Paul, worked very hard on your behalf and the members' behalf. Also the other committees, the Conference Committee, the Standing Orders Committee, the Head Office Committees and the Rules Committees, headed up by Peter, done a mountain of work during the year. I'd also like to say well done to all our staff in Head Office, Elaine and Aisling and Lydia and Des, Seamus and Declan. You do busy very well and pleasantly. I would like to wish Margaret McKenna every good wishes and prayers in her battle with serious illness. Also, to the Murphy and Gahan families, we wish you every strength into the future. Joan and Johnny were two very special people with a great love and passion for everything P&A, and we're very familiar faces at our annual delegate conference. We remember you very fondly. Willie Doyle, we will miss your contribution and good humour. You take care of yourself. And Ed is also standing down, but we hope that Ed will be back again, as I think there's some rotational agreement. And thank you, delegates and the branch officers and committees, for your dedication to trying to improve conditions for members and for our service users. You are certainly God's chosen people. Thank you.